Prime Minister Justin Trudeau and Ontario Premier Doug Ford today signing a 3-year, $3.1 billion health agreement. Ontario is the 5th province to reach a deal with the feds after BC, Alberta, PEI, and Nova Scotia. This agreement comes as Ontario faces massive staffing shortages with a record high number of patients looking for a family doctor. That has created ripple effects inside hospitals with backlogs in emergency rooms. The province has promised to hire hundreds of new family doctors and nurse practitioners, including those who are licensed elsewhere in Canada. But how quickly can Ontarians expect concrete improvements? Joining me now is the president of the Ontario Medical Association, Dr. Andrew Park. Thanks for being here, Dr. Park. I'll get right into this. In an interview, your predecessor, Dr. Nadia Alam, said that the healthcare system is in dire straits right now, adding, "It feels like we're moving furniture right around the house while it is on fire." Would you agree with that assessment?
Yeah, I think that we have some real challenges in the healthcare system right now, amongst which primary care, which is a foundation of our system. And when the foundation is cracked, it does have major implications for the system at large.
So how significantly and quickly can today's announcement address those major issues in the province's healthcare system?
Well, I think it has great potential to, particularly in the primary care side, as well as the mental health side, to improve the care that we're delivering on the front lines immediately. We'll have to see how the money gets rolled out and how quickly and how accessible that money is to care teams. But we're excited about the news today.
Was it enough money?
Well, I mean, the reality is no. We've been calling for an increase up to 35% of healthcare spending in the province to be paid federally. And right now, this doesn't get us there. But again, when we're talking about real patients and getting that care to those patients who've been waiting for so long, this is a welcome signal to say that, we're working our way closer to that figure.
In terms of funding, and for Ontario, I know you speak for the OMA, but really right across the country, how far behind are we with healthcare funding?
Yeah, I mean, you're right. I speak for Ontario, but the reality is that this is something that's felt across the country. And as I said, I think we have a ways to go, and I think we need to continue to put pressure on the government. We need to continue to provide the solutions for the government to ensure that we're working in tandem to get care to all Canadians.
Now, part of today's announcement is to remove barriers to foreign credential recognition, simplifying licensing and processes and all of those types of things. How many internationally trained doctors do you think could now be allowed to work in Ontario by removing all of those barriers?
Well, I mean, that's a welcome change, particularly from the 4 countries mentioned, the U.S., the U.K., Australia, and I'm blanking on the 4th one right now, but that's important because we do have a lot of Canadian students that are traveling abroad to study, and they would be welcome back into the country to practice immediately. We're also releasing or loosening restrictions on those that are coming from other countries in the way of a practice-ready assessment, so that we can use our local mentors to ensure that they are up to the credentialing, the standards of Canadian physicians. This is going to make a difference. But I will temper that with, we're not going to hire our way or necessarily train our way entirely out of this problem. There is international competition that's very stiff for human health resources. So we have to be very creative about the best way to deploy those resources. And that's a lot of what we're talking about today with team-based care as well.
Yeah, I believe that 4th country is Ireland. But to that point, then what do we do? I mean, if we can't hire our way out of it, then what is the path forward?
Well, what we're really talking about is system capacity. How much capacity can we absorb? And the place where we have the greatest ability to absorb that capacity is in the workforce that's currently present. What we've been calling for is team-based care. So, not all bucks have to stop with the family doctor. Let's support them with a team. So if you have an ailment that is better served by seeing a dietitian, a social worker, or a nurse, a pharmacist, then let's support and let's do things concerted and integrated as a team. The other thing is that our family physicians in Ontario are facing upwards of 19 hours of administrative burden. We need to focus on removing that so that we can increase the capacity of family doctors to actually see their patients.
Yeah, and to that point, I know you said you can't hire your way out of it, but part of this $3.1 billion is supposed to go to hire more doctors and nurses for the province. Do these people currently exist, or do they have to be trained first? I guess my question is more, is there a lag time that Ontarians now have to wait for these people in these different, medical teams to actually be in place?
Well, I'd approach that in two ways. Number one is that there is the ability for us to reimagine primary care as being an attractive and viable option for physicians, and I think that will drive family physicians into comprehensive care, like even in the experiment that we're seeing in BC. So I think there is potential there. In terms of, are we going to hire or train physicians right away? No, the answer is no. I mean, we've gotten here over a long period of time, but this is a really good start, and I think that we should be happy that we're really focusing our attention on the right places, but I think it will take a little bit of time.
Yeah, and looking ahead, the Ontario College of Family Physicians said last year that 1 in 5 Ontarians will be without a family doctor within 3 years. That counts 3 million people. So I think a lot of Ontarians and Canadians who are maybe looking at this for it to be replicated in their province are sitting back and saying, okay, well then how long until I get a family doctor?
Yeah, the Ontario government announced $110 million for teams for primary care, family doctors, nurse practitioners, and that's projected to increase attachment by 300,000 patients. Those are the kind of scale in terms of numbers that we're talking about. So again, this is where we need to focus our attention. The fact that we're doing it is a good thing. I'm hopeful that in the next calendar year, we're seeing some real progress towards the accountabilities in this transfer to say we are driving those numbers down, or at least we're gaining more attachment than we're losing attachment, because it's been a losing battle for a long time.
Last thing I wanted to touch on with you is that both Premier Ford and Health Minister Sylvia Jones boast that Ontario has the shortest surgical wait times in the country. According to the Fraser Institute, in 2023, from referral of a general practitioner to receipt of treatment, it's 21.6 weeks. That's still a long time, but back in 1993, it was just 9.1 weeks. Do you think that this money is going to help Ontario get closer to that gap that we had seen back in 93?
I mean, that has to be the standard. The reality is even if we are amongst the quickest provinces in terms of wait times, it highlights a couple things. Number one, is it's still not good enough? And number two is that this is a fairly pervasive problem across the country. And again, ensuring that our foundation is solid through a good system of primary care, and then increasing that through the acute care systems of wait times and specialty care is going to be extremely important.
Okay, we're going to have to leave it there for today. I really appreciate you spending the time with us. President of the Ontario Medical Association, Dr. Andrew Park. Thanks again.
Thanks for having me.